we often recognize the great work that our firefighters and paramedics are doing across our community. Not only are they fighting fires when they do occur in our community and responding to other building related issues, but they're often responding to medical calls as well. And unfortunately, sometimes those do involve drug use or misuse and the many ways that that affects our local community. But the fire department partnering with other local community organizations to help curb substance misuse all across greater West Bloomfield and beyond. They got a special event coming up very soon, and joining us to talk about that and more is Deputy Fire Marshal Dave DeBoer from the West Bloomfield Fire Department. Dave, thank you for being with us today.
Good morning, Tyler. Hey, thanks for having us.
Yeah, glad to have you on. As always, we love having the fire department join us on this program. And it's even more important as we're talking about a really touchy subject because it affects so many people across so many different lifestyles, including here in our community. Substance use and misuse is a real problem, even in a place like Greater West Bloomfield.
Yes, even though we have a wonderful community here with a lot of resources and a lot of support and things, people don't often think of this as a community that would have that need, but the need is everywhere. And unfortunately, this epidemic that we're facing right now it crosses all socioeconomic boundaries. It can affect any family. Nobody is immune from this. Absolutely nobody.
And so, how does the fire department play a role in responding to this? Because not only are these issues present in our community, your team is often the ones that are the first there to respond and often enact those life-saving measures.
They are. Our paramedics are responding on these calls, and unfortunately, we're responding on calls that we're too late for, which is why we implemented the program last year, where we're getting Narcan out into the field and fentanyl test strips out in the field and Datura bags so that people can dispose of medicines and get rid of medicines that they don't need around the house. We're taking kind of an all of the above approach because this epidemic is affecting us here locally. And here in the state of Michigan, we're losing a person every 4 hours around the clock. So 6 times a day, somebody's losing a family member to this epidemic. It's literally that bad here.
Dave DeBoer joins us from the West Bloomfield Fire Department. He is their Deputy Fire Marshal with us on the Splash Live today. And you mentioned some of the resources around the community, nasal Narcan and other resources that are put in places like these Save a Life boxes that we know are at Town Hall, at the library, and at various places across our 4 communities. Why is it important that the community have access to these resources, not just if they need them or if they're seeking them out, but really anywhere in these common places in our community?
Yeah, there's been a little controversy. Some people didn't understand, what we were trying to do there. Are we actually making it better? The goal of those resources is to have them out in the field, have them in people's hands, because we know it takes us as paramedics about 6 minutes to get to you. And 6 minutes is way too much time if somebody's not breathing. If they've overdosed, we need to get that medication in them faster. And we have success stories here in West Bloomfield where that medication has been administered by bystanders and kept that person alive long enough for the paramedics to get there and save their life. So, and the importance of that is it gives that person that next opportunity to get into a rehab program, to get the help they need, and hopefully break that addiction. That's the goal of it, and we think it's working. It's not uncommon to hear from people struggling with substance abuse disorder that they overdosed multiple times before they finally said enough is enough and got help. So we're simply trying to get that person to that next opportunity to get help. And without it in the field and in people's hands, we would not be saving the lives we are.
There's plenty of more information related to health, to safety, and of course, to fire safety as well on the West Bloomfield Fire Department's Facebook page, facebook.com/WB Fire Department. We're joined by Deputy Fire Marshal Dave DeBoer on the Splash Live. And a lot of what the fire marshal's office, what the Deputy Fire Marshal also does too, is going out in the community, assessing these situations, particularly investigating fires. But a lot of what you're also doing across the board with the fire department's duties is education related. How does education play a factor in not only addressing the substance use issue, but also people understanding the resources that are available to them that could help them save somebody's life?
The education does a lot of things, and we've been doing it for over a decade here in West Bloomfield. it breaks down the barriers, it breaks down the walls of that people and the stereotypes that people have of what does drug addiction look like. A lot of people think it's the old 1970s version or something you've seen in movies, and it's just not. We're seeing people that think they're taking a legitimate medication, but overdosing because somebody has laced it with fentanyl or carfentanil or some of these other drugs that are coming on the market that are flooding into our country. These medications, like I say, often look like a medication you take. You can These bad guys can get the pill presses and they can make them look like anything. They can look like a Tylenol. It can look like an Adderall. It can look like common medications, and people overdose on them. So we want to get that education out there. We also want families that are struggling to know that they're not struggling alone. We want to partner with them. We want to support them. And that's what this Hope and Healing program adds, that capacity that we can bring other families alongside them that have walked this same walk and allow them to support them and help them get help. Because addiction doesn't just affect that person that is struggling, it affects the entire family and their support network around them, and it can affect them in devastating ways. So as paramedics, we see that on a daily basis, and we want to interact, and provide better care, provide something more to the people, and bringing these extra resources will do that.
Yeah, and it has those rippling effects too from those immediate groups related to the person affected by the substance use and then outward into the community, and so that can have a major impact. All the more reason that education plays a big role in this, and partnership too. You mentioned the Hope and Healing program with the West Bloomfield Fire Department. That's in partnership with another community organization, and you've got an event coming up at Fire Station 5 very soon that kind of encapsulates all that and gets the community familiar with this program. Tell us about that.
Yeah, Thursday afternoon we'll actually be doing the official rollout of the program. We've been working with them for a few months here. It allows us to hand out some information to family members, so family members can get help. It gives us the ability to get somebody directly into treatment. People will be able to come to a fire station if they're struggling with substance use disorder and say, "I need help." We'll bring them in. We'll get them that help. We'll get them. They have in this program with Families Against Narcotics, who runs the program. They have what they call their angels, and it's a network of volunteers that can come stand alongside that person and get them into a facility quickly. As paramedics, we're limited. We can take you to a hospital, because by statute, that's all we can transport you to is to a hospital. So we're limited there, and that's not always the right resource for the person. This gives us the ability to take that person directly to a care facility for the care that they actually need. So we're really, really hopeful that this is going to help more people.
And what should people know about the Hope and Healing program as a whole? It's as you said, a partnered effort with Families Against Narcotics that kind of brings all of these different elements we've already talked about kind of into one specific effort. But how can the community participate?
Well, they can make sure that people know about it. Make sure it's known in their community. If you're in groups with whether it's a church, synagogue, or a temple, make sure the people around you and your groups and your sphere of influence know about these programs, because there's a lot more families suffering from this than people think are out there. And it might be the person next to you in your office. It might be the person that you see every week at religious services, that has a family member that's struggling and doesn't know that this exists. So we want the public to know, and the public to help partner with us to spread the word that help is out there. Things are available, and we're ready to give that extra resource to people, and help them.
And that knowledge can be incredibly powerful to just understand the resources that are available to you in the community, whether you're going to need access to them now or later, whether you know someone that needs access to them or not, because ultimately, while our firefighters, our paramedics, our police officers are our first responders, often those that are the first ones there to see these incidents, these overdoses, these other emergencies are just regular people every single day. And so I would imagine that makes it all the more important that people are aware of a program like this and that people engage in a program like this too, Dave.
Absolutely. We want all the resources we can for folks that are struggling. And again, it's not that wanton drug user, drug abuser. These are people that started out with pain medication or started out with an injury and it led into an addiction that we're now facing the consequences for. I think everybody is aware of the big pharma settlements and the big pharma issues that were out there, where the pharmaceutical companies really pushed these dangerous drugs on the community, and we're still seeing the repercussions of that. And that's what we're fighting against. This is your neighbors, folks. It's people near you. I guarantee you interact with somebody every day that has a family member that is struggling.
It's our entire community's fight. And there's a lot of strength in numbers. All the more reason we put these efforts out, and all the more reason we're glad to be joined by you, Dave, today to talk about this and to get this awareness out. Again, it's the Hope and Healing kickoff event with the West Bloomfield Fire Department and Families Against Narcotics is on Thursday. Dave, I don't recall if you had mentioned it earlier on, the time of day or the location for this, if people in the community want to participate and, of course, learn more.
Yeah, we would encourage people to come out. It's 3 o'clock at Fire Station 5, which is on Maple Road between Orchard Lake and Middlebelt. The public is absolutely welcome to it. We would love to see people come and support and show that support for their neighbors and the community at large that needs this help. I think West Bloomfield is a great community with lots of supportive people and people that care about one another, which is what makes this the great community it is. So we'd love to see the public come out.
Yeah, I tell you what, as I make my way home at the end of many days and I go to a local gym on my way home, I see one of those Save a Life boxes right outside of it. And that just tells you everything you need to know about how seriously this community takes addressing the drug misuse and drug abuse issue person to person. Dave, thank you so much for joining us today.
Thank you. Thanks for having us.